For the next complication of pregnancy, which we'll be looking at, we'll look at what is known as the infant shoulder presentation. So we have spoken a lot about how a baby should present for childbirth, and looking at all these presentations, at least the better one is the vertex presentation. Alright, at least the facial presentation, you can repair it, you understand? The brow presentation too, you can repair it. But anything like the baby is presenting with the anus, or the baby is presenting with the shoulder, like what we'll be talking, right? Well, of course the baby will not be able to pass through the birth canal, so you have to go into cesarean section. So shoulder presentation is just simple, it's literal. So it's a serious type of what? Malpresentation during childbirth. So the baby is not presenting in how it is supposed to present. Baby is supposed to present with the head, you know. So this is where the baby lies sideways in the uterus, and the shoulder, the arm or trunk becomes the presenting part in the birth canal instead of the head and the buttocks. So why it matters is it's not possible in this position. All right, vaginal delivery is not possible. All right, so it occurs in about 0.5 of birth, and it's more common in premature babies. So most of the times when your baby is forming optimally, it rearranges itself. Okay, but the baby is premature, you have these malpresentations. So causes, right? So problems from the mother can be causing these issues. Problems from the baby can be causing these issues. So from the mother, maybe she has a laxed abdominal muscles or laxed uterine muscles. That means they are just too soft, you know. Contracted pelvis, uterine malformations, placenta previa. From the baby, maybe the baby is premature, because if the baby forms completely, you know, it rearranges itself. All right. Multiple gestation. Sometimes it's so many twins, triplets, so they kind of like push themselves. So one is presenting anyhow, right? Polyhydramnios. If the amniotic fluid is too much, the baby is swimming too free. Okay. Then intrauterine fetal death. Maybe the baby is dead, so it just comes anyhow, you know. So diagnosis, if I want to see if a baby is presenting, right? Ultrasound, vaginal examination, abdominal examination. This way I can palpate to check for what the position of the head, you know. So complications could lead to what umbilical cord prolapse, where the umbilicus is falling to close the cervix, you know. Obstructed labor, the mother is pushing, the labor is taking so long, right? Uterine rupture, and the baby can be denied of sufficient oxygen. So this could lead to the death of the baby, or you give birth to a baby and the abgas core is not nice. Okay, the baby is very weak, it's bluish, that's sinuses and all.